Good evening, Professor. My name is Aarti Seni, and I'm a student of Nursing Leadership and Management, student at Sanika College, King Campus. And today I'm here to discuss the assignment on the topic the nursing role in Canada. So here I will be discussing the summative knowledge of the role of the professional nurse within the Canadian healthcare system. So leadership is essential for patient safety. To enhance leadership ability to provide safe patient-centered care, nurses must reflect on their leadership abilities. Nurses must use cognitive skill to make appropriate clinical judgments while providing and planning care for clients as per the NCSBN. Being the leader, nurse must ensure that documentation presents an accurate, clear, and comprehensive picture of the client's needs, the nurse's interventions, and the client's outcomes, as stated by CNO documentation revised in 2008. Nurses are accountable for maintaining the privacy and confidentiality of health records of the patient. Other important function of a nurse is obtaining informed consent. Consent is required for the patient to share his information with other health team members. The Personal Health Information Protection Act guides with who patient health information can be disclosed. Consent can be written, oral, or implied. Nurses must follow the procedure of obtaining the consent. Nurses have played an important role in the health history of Canadians. The history of nursing in Canada begins with Mary Rolette Hebert, who settled in what is now known as the Quebec City. She assisted her husband in providing care for the early settlers from 1617 until her death in 1649. Gregory and colleagues describe how she consulted with indigenous peoples regarding healing methods. So, understanding nursing pasts will help today's nurses move forward as they deal with current issues such as nursing shortage, supply and demand issue, healthcare funding cutbacks with hospitals replacing nurses with lesser skilled workers, etc. Healthcare in Canada is delivered through the provincial and the territorial system of publicly funded healthcare called Medicare. It is directed by the arrangements of the Canada Health Act 1984 and is universal. It covers approximately 70% of the Canadian healthcare needs and 30% is paid through the private sector and is not covered or partially covered by the Medicare, such as prescription of drugs, eye care and dentistry. Working in community sector, nurses must know the determinants of health, which are range of personal and social, economic and environmental factors that determine individual and population health. Assessing patients of assessing patient is part of a nurse's profession practice to keep patients safe and improve patient health outcomes. So these are the references. Thank you.